Now, the NHS are calling for patients to book their winter vaccinations to avoid a tripledemic of flu, COVID-19 and RSV.
They're saying that it's the key to preventing a challenging winter for hospital and emergency services, which is why Dr Raj is here to tell us more this morning. The tripledemic.
It sounds serious.
It sounds so ominous.
I think it's quite an exciting word, isn't it? Tripledemic.
Yeah, wow.
But we're here to break it down. Okay. And basically, the tripledemic is referring to the circulation of 3 respiratory viruses. So we're talking about influenza, which we talk about every year.
Standard, yeah.
Then we've got COVID, which has been there as well. And then we've got this year RSV.
What is RSV?
Yes.
Yeah, so RSV, if you've got little ones, you might know what RSV is. So RSV is respiratory syncytial virus. And this is a really common virus. It's been around for ages and normally occurs in sort of babies and infants and children and can lead to a condition called bronchiolitis. You might have heard of bronchiolitis. Basically, inflammation in the lungs can lead to coughs, fevers, sort of breathing issues, shortness of breath, wheezing. And normally self-limiting, so children will get over it, but there's a small chance of vulnerable groups and younger infants who can be hospitalised. And actually, annually, I think it's 30,000 children get hospitalised from it. So affects babies and infants, but also can affect the older group of people, so around 75 to 79.
Grandma and granddads.
Exactly, grandma and granddads, who may have existing lung conditions, and they might get worse with RSV, or who may then contract pneumonia in the winter months, and obviously that can be fatal. So RSV is one to watch out for this winter. It does peak in the winter months, and we know that it's obviously circulating and shooting up between November and February.
But am I right in saying this is the first time there's an RSV vaccination that's been made available?
Yeah, so that was the JCVI, so the Joint Committee of Vaccinations, which they decided that actually to help prevent hospitalisation, severe complications from RSV in those groups to obviously, roll out a vaccine this year. So the vaccine is available to pregnant ladies from 28 weeks onwards. Now, why pregnant ladies? Because their children were most at risk once they're born as infants and babies. Up to the age of 1, you're more at risk of getting severe complications from RSV. Right. And then those in the age of 75 to 79. So they're also eligible for the vaccine.
Just a quick question for you. Obviously, we want people to get vaccinated and things like that. But is there anything you can do to, help to not kind of catch anything?
Absolutely, and I get asked this all the time in clinics. So basically, simple things, simple measures, hand hygiene.
Right.
Okay. Like my little one always says, I should sneeze in my elbow. They learnt that at school, which is quite good. So if you've got little ones, and remember, they are hot pots. If you've got little ones, they are passing viruses around like anything at the moment. So sneezing into your elbow, using a tissue, washing hands with soap and water, doing those motions to really cleanse the hands. Also, if you're elderly or in a vulnerable risk group, you're pregnant, you can use a mask over the winter. I know we use them over COVID, but it is still a thing. You can wear them and go out in public spaces. Also, we know that viruses shoot up around this time because we're spending more time indoors. Yes. We're all kind of mixing and mingling. So you can socially distance if you're not feeling well. I went into a meeting yesterday and somebody said, I've got a sniffle. I sat on the other side of the table and I was, I made no apology of it. I just said, I don't want to get ill and I don't want to pass it to my patients and other people. So you can keep physical distancing as well. So lots of different measures you can take.
Okay.
As well as just a good diet, looking after yourself, all those typical things, sleeping well, to ensure that your immune system's doing good. OK,
let's talk about the other vaccines then. The COVID vaccine is being offered again.
Yes, it is. So the booster's being offered. So again, eligible to those who are 65 years and over, at clinical risk groups. So those are people who have certain comorbidities, things like diabetes, liver disease, heart disease, COPD. The full list is on the NHS website. Also to pregnant women, and those on the front line, those who are in, care homes, residents and staff as well. So being offered to all of those.
And these different now? These vaccines different to the ones we had during the pandemic?
Yes. So just like the influenza vaccine, every year a new booster or new vaccine will come out to basically target a specific strain that they think is going to be the strain that's going to cause issues, basically severe complications, hospitalisations. So not only to reduce the strain on the NHS, because we already have that, but also if you're somebody who maybe had a problem with COVID before, you're somebody who has got a severe complication, lung disease, etc., you don't want to catch COVID or any other respiratory virus and end up in an overwhelmed NHS hospital. So you might want to think about taking the booster and consider that as well.
And you can actually buy a COVID vaccination from the pharmacy? You
can. So flu and COVID vaccinations are available privately from popular NHS chemists and pharmacies. They're normally around, I think, the COVID one, I think, is around £45 upwards for a booster. But if you are not on the eligibility list, you can opt and go privately to get one if you wish to.
Do you have to ask for a certain one, though? Is there different variations of it, or because you just said that they change them depending. So do you have to be very specific about what you ask for?
There will be one that they're rolling out, so that'll be it.
Okay.
Yeah, for each year for a strain.
There has been a lot more of COVID around, and I'm sure lots of our viewers many of them would have had COVID quite recently, and they'll be thinking, well, do I actually need to get the vaccine because I've probably got some immunity to it? What's the situation there?
You will have immunity to it for a short period of time if you've had COVID. However, if you are wanting the vaccine and you've had COVID recently, there's nothing stopping you from having it. You just have to be feeling well, so no fevers, not under the weather, but there's no sort of time frame between having COVID and then having the vaccine. Also, interestingly, if you've never had the COVID vaccine and you never opted for it or opted out and now feel that actually I want the booster or the vaccine, you can still have it and it will still give you some immunity. It will still give you...
It will work.
Yeah, it will still work, yeah.
What about flu vaccinations? Because actually my 2 boys have been offered it at school and they're going to have, like, same with you
nasal.
as well.
Yeah,
they do like a nasal one, right?
Yeah.
So what happens with that? Is it available to anybody, the flu vaccine?
So the flu vaccine in schools for little ones is the nasal one. For adults, it's still obviously the one that we inject in. Now, that is available, again, on the NHS with eligibility criteria. So those who are 65 or over, if you're from 6 months to 18, 6 months to 64, actually, and at clinical risk group, you'll be offered the vaccine. That's the same thing, comorbidities like diabetes, etc. If you are pregnant, you'll be offered it. And if you're a care home resident or staff or a frontline health worker, you'll be offered it for free. But the flu vaccine is available, again, privately. So you can go and buy it, from Boots or Superdrug, or wherever it might be. There's pharmacies that are doing it. Private clinics might be doing it as well. So you can pay for it and have it if you want.
But in theory, if you're in the vulnerable group, you will be contacted by your GP surgery or your doctor to say, look, the flu vaccine is available to you now, come down and make an appointment.
Absolutely. So she'd already be rolling that out as of Monday just gone. And the vaccines start, I think it's on the 3rd of October. So you can book them in from now. And millions of people will be being sent out emails, letters and texts. You can book, though, via the NHS app. You can book on the website. And you can also call 119, I think it is, to call in. But if you're confused or you haven't received anything, just contact your GP surgery and they should be able to check it out for you. What
about those people that say, if I have a flu vaccine, it really kind of makes me feel terrible? Yeah. Like, is it worth doing? What would you say?
I've taken a flu vaccine every year, but obviously I'm on the front line, so for me it's important because I'm interacting with, vulnerable patients. And I've also had flu, and I will tell you, yes, you might feel a bit under the weather for, maybe it's a day or two. It's different for most people. For me, I get a bit of a sore arm and I might feel a bit sniffly for a day, but nothing near what you feel like when you've got influenza. If you get full-blown influenza, the muscle aches, you're bedridden, you're unwell, and if you are healthy and you're feeling that way, imagine if you have a comorbidity or you're at a vulnerable risk group and you get it, you're more at risk of hospitalisation, severe infection, complications, and even death. So actually, I think it is worth it. Yeah.
It's worth it.
Dr. Raj, thank you for all of that. It sounds worrying, doesn't it, the Tripledemic? But actually, when you put it into perspective and think there's ways of combating it, then it's really good to hear.
Absolutely.
Thank you.
Oh, hello.
Thank
you for visiting our This Morning YouTube channel. We upload tons of new content every single day. So hit the subscribe button, like all the videos, and don't miss out. We'll see you in the morning.